Hello everyone. Today I have with me Dr. Krishna Sahith, who has just graduated on 26th of June, and in this video he will be sharing with us his mindset through all 6 years for KROK1, KROK2, what books he was referring to, what external sources he was using, and what is he doing to prepare for his NCI examination. And there's a lot more to come ahead, so stay tuned. So first of all, congratulations Dr. Krishna Sahith on your graduation, and please share with me and with us, how has your journey been through the past 6 years?
The 6 years journey is really tough.
Okay.
Actually, because you actually learn what is responsibility.
Right.
In these 6 years. There are many drawbacks, there are many things which happen good to you, there are many things which are really bad, but whatever it is, life,
Right.
you just need to keep going, keep pushing yourself all the time. So at the same time, you even have to study, you'll have many difficulties while studying, many times you'll feel upset and all.
Right.
But even then you have to force yourself, because that works makes you a better person in the future. Yeah.
Right. And so when the student enters in the first year, and he has been or she has been told that they need to prepare for KROK1, what are the subjects that the student needs to focus for first, second and third year?
Yeah. Regarding first, second and third, many of the students in the first year, they keep on messaging me that they wanted to prepare for USMLE directly.
Right.
So that is not the right way, because to prepare for an USMLE exam, you need to have knowledge of complete non-clinical subjects.
Right.
So the complete knowledge of non-clinical subjects you will get by the end of third year if you have studied everything perfectly.
Right.
So for the first, second and third year, mainly for the first year students, I'll tell them to focus on anatomy, physiology, biochemistry.
Right.
These three are the very basic subjects.
So it has to be for the first year student, right?
Yeah, for the first year student.
So it has to be anatomy,
Yeah.
physiology and biochemistry.
Yeah, but however they teach only anatomy in the first year.
Yeah.
And you no need to concentrate more on medical biology, because that
Okay.
you have learned in your +1 and +2 classes.
Yeah.
Right? Back home. So focus completely on anatomy. Focus in the sense, at least if you are perfect with anatomy, physiology and biochemistry, at least 80% in each of them,
Right.
then the later on years will be really very easy to study. Or
Right.
else it will be really very difficult even to understand the sentences.
Okay.
Yeah.
So these subjects should be on tips, right?
Yeah.
And also I would like to mention that Dr. Krishna was also teaching in cooperative classes for KROK1 and the basic subjects. Many students, I'm sure you already know him personally, and he has been also been a part of UFO's doctors practical classes. So moving on to KROK1. So as the student approaches KROK1, and he has been in second year now, and what kind of study routine he should follow, and his focus and determination, his discipline, if you could just help us.
See, the main goal is not to pass KROK1.
Right.
So definitely every student, if they practice the previous 10 years papers and if they are perfect with the base, they will pass the KROK1.
Right.
But the point is, what you have learned in these 3 years is very important.
That's right.
See, everyone can pass KROK1 if you have completely focused on the materials and all. I mean, all the questions from about 1 month. If you have started preparing from 1 month, it will be really very easy.
Okay.
Yeah.
You mean 1 month prior to KROK1?
Yeah, just 1 month prior to KROK.
Oh,
Really.
if we just do the previous year's question papers.
Previous year's
Yeah?
question papers and the previous year's basis.
Okay.
Yeah, but the thing is, that is not our goal.
Yeah.
Our goal is to become a best doctor, as every one of you know.
Right.
So for that, what you need to do is, you need to really learn the basics, because most of the students till the 6th year, they won't have perfect basics. So if you don't have perfect basics, you won't have confidence. When you don't have confidence, you feel fear when you are studying books like Harrison, Davidson and
Right.
huge books.
Yeah.
So what I tell for the first, second and third year students is, even if it is taking a lot of time to study a little topic. For example, let us say neuromuscular junction. As most of you know the topic,
Right.
neuromuscular junction in the physiology. It takes around 30 to 40 minutes. But when I was a second year student, I took about 4 hours to study that.
Okay.
I know that I wasted a lot of time, but I still remember that. You know.
So it's never too late.
It's never too late. Whatever you are studying, it is not wasted at all.
Right.
So the thing is, you have to go in very much detail, because these 3 years you will be having sufficient time to study. So you need to go very much detailed in each and every topic.
Right.
So in that way, when you learn the basics, I'm telling you, 4th, 5th, 6th year will be really, really very easy.
Okay.
Yeah.
Based on our subjects in the previous 3 years.
Yeah. And regarding KROK1 materials, what you need to do is, you no need to completely study all the books from the first year to second. I mean, if you are a third year student, if you are preparing for KROK1, you no need to turn up all the pages of first year and second year. What you need to do is start preparing 4 months before at least. Why I'm telling 4 months before is, so that you can study the base in such a way that you can even read the explanation of each and every option.
Right.
Because not just simply reading the question and knowing the answer is not enough.
Right. Right.
And another important thing is, most of the students, what they do is they mug up the questions. Like if they find some marker over there,
Yeah.
They put this as an answer.
Okay. Like just cramming up from some
just
highlighted
cramming
text.
up. Yeah.
Right.
He went to the river, then put this answer.
Okay.
He went to the garden, he put this. No, that is not the correct
Right.
way of preparing. You might pass the exam, but that is not the real way of studying.
For the future, yeah.
Yeah. So let it take time, but study everything with each and every option explanations.
All right.
Yeah.
And also, Dr. Krishna, he personally has his own YouTube channel on which he discusses each and every question for KROK. Is that right?
Yeah.
And I'll provide the link to the channel in the description below, so you all can click it and have a look, and also subscribe to his channel as well. So this was for KROK1,
Yeah.
right? Even if a student is not prepared, but this is, I'm not saying that we do not need to study for all the 3 years and just prior 4 months.
And one more thing
Yeah.
is, till my batch,
Yeah.
I mean previous to my batch, till my seniors batch,
Right.
if you have completely mugged up all the question papers from 2010 till date, the same questions, around 80% of the same questions would have been repeated.
Okay.
Yeah, they were repeated actually. But from my batch, the situation is completely changed. They are increasing the standard of the paper.
Right.
The paper is getting really tough. In my batch, the paper was tough, and the later batch also the paper was tough, and of the next batch also, not only tough, even they have reduced the attempts. Previously there were 3 attempts.
Okay.
Now there are 2 attempts, and these 2 attempts are really very tough.
Right.
So what I am telling is basics. I always tell the same thing,
Yeah.
basics. That's it.
And also, thank you for this information. And so, how was your routine before KROK1?
My routine for KROK1 was in maybe June or the before month.
All right.
I don't remember exactly, but I started preparing from January.
Okay.
Yeah, the same I did for KROK2 as well. So what I did was, I've started 2014 base. Yeah,
So he started from
base.
2014 base.
Yeah, that is an updated base,
Okay.
obviously. So I mean, at my time that was an updated base.
All right.
So I started from 2014 base, and the first subject which I chose was physiology.
Physiology.
Yeah,
Okay.
physiology. Because physiology is the basic for all the subjects. Because if you clearly understand all the mechanisms in physiology,
Right.
then it will be really very easy to understand the remaining subjects.
I'm sorry to interrupt. Actually, this was my next question, that what is the main subject that we need to study so that we can get help in other subjects as well? So that is physiology.
Yeah, that is
All right.
physiology.
Thank you.
So what I did was, I started with the base, started with physiology, and it took around 2 to 3 weeks to complete the physiology base. And
Okay.
the questions were just 150 questions.
And this is when you were researching each and every option as
every
well.
option, because I have time, right?
Right.
So I sat around 6 to 7 hours a day. 6 to 7 hours a day with 1 hour break in between.
All right.
6 to 7 hours a day straight, and in that way I completed base by February ending.
Oh.
Yeah, February.
Okay.
The total base. I mean, all the subjects, all the 9 subjects.
So 6 to 7 hours a day, and you completed all the bases for all the subjects.
All the bases of all the subjects. Because see, if one base, if you choose any one subject, one
Right.
or two subjects like physiology and biochemistry,
All right.
and if you go in picture detail of each and every option,
Right.
and once you're perfect with these two bases, then when you go for pharmacology or when you go for pathology,
Right.
the same concepts will be repeating there. So you need not to study again the same thing. So in that way you can save the time.
Okay.
The same concepts,
Yeah.
the questions from the same concepts will be repeating in pharmacology, will
Okay.
be repeating in pathology, right? In pathophysiology.
Right.
So everything will be same. I mean, not
Okay.
everything. Most of the questions, around 20 to 30% of the questions will be same from the topics which you have already studied in detail.
Right. So there's a lot of relation in the questions.
Yeah,
Yes.
there's a lot of relation. So you need not to spend a lot of time
Okay.
in those questions which you have already prepared. So
Right.
it is better to spend time in the questions which you are newly preparing.
Yeah. And also, were you using some applications for KROK1?
Yeah.
Okay.
So the basic application which I used was eNeutron.
Oh, eNeutron for KROK. That's for Ukraine,
That
yes?
is the best website.
All right.
Because you can also check yourself. You can do the test online
Right.
and all.
So I'll provide the link for the website as well in the description below. So the site you were using was eNeutron. Was there some other application in the first 3 years that you were
In the first
referring
3
to?
years there was no application. I mean, now there are a lot of
Yeah,
applications,
yeah.
but in the first 3 years only eNeutron was the only
All
one.
right. And also, were there some specific books which you would like to recommend for subjects for the first 3 years for KROK1?
For the KROK1, see, there is actually no need of mentioning about the books, because the first year students who come from India, then definitely they will take a bunch of books and they
All
read
right.
them.
Yeah.
But anyways, the books which I prepared are
Yeah.
for physiology. I prepared Guyton.
Guyton all, yeah?
Yeah, I mean, I didn't read the total Guyton physiology.
All right.
Like if I wanted to go detailed in so and so topic, I used to go in picture detail in that book.
Okay.
The lines are very easy. The text is very easy to understand, very
Right.
easy to learn and all. Next, for anatomy, most of the students use B.D. Chaurisha,
Yeah.
Cunningham's anatomy.
All right.
But I choose Gray's anatomy.
You chose Gray's Anatomy.
Yeah,
All
Gray's
right.
Netter Atlas
Yeah.
as well as the Gray's anatomy. So in Netter Atlas, what I did was completely I focused on the pictures.
Okay.
Yeah, during my first year, I used to keep on drawing the pictures. In that way, I learned the anatomy.
So you, for anatomy, you used to draw the pictures yourself,
I used
yes?
to draw the pictures. I think I've drawn almost all the pictures.
Yeah?
I don't have the notes at present now.
Oh, okay.
But I've drawn all the pictures. Even your drawing is wrong, or even if your drawing is really worse, but nothing to worry. But I never went studying the textbook.
Okay.
I just drew the picture and then I went to study the text.
All right. So you already had a certain understanding before, yeah?
Yeah. And another important thing is, in anatomy especially and in any other subject, imagination is the most important thing.
Right.
If you can imagine something, really it will save a lot of memory and it will really help you.
All right.
Imagination is must. I tell all the students to imagine, because even when I teach, the before day, I prepare some set of pictures and I go to the board and I teach.
Right. Yeah. I attended few classes of Dr. Krishna, and yeah, that's true. You taught us about myocardium.
Yeah.
And you I think within 5 or 6 minutes he drew complete detailed picture of the heart, and that was really impressive.
Yeah. So I prepare a set of pictures and I go to the class.
All right.
And I draw them and I may explain. So most of the students can understand, but
Yeah.
some of the students can't understand that.
All right.
So in that minute, what I can do is I have to imagine the picture and I have to draw it in another angle. So for that you need not to prepare. If you really have an imagination
Right.
power, if you really practiced how to imagine, then definitely if student didn't understand the set of pictures which you have drawn, you can imagine yourself, okay, let me put the head laterally like this,
Right.
or let me elevate the neck, let me put it down like this. So in that way you can explain it.
So he picturized the anatomical part so thoroughly that even you could draw it from certain angles by imagining, yes?
Yeah.
That's a great tip actually. Thank you so much. So that was for KROK1, right? And so when
And one more
Yeah,
thing is,
sure.
Once I have done with my base
Yeah.
by February ending, then I started the question papers.
Okay, then you start the question
Yeah,
papers.
most of the students, what they do is they first start the question papers.
And then the base.
They don't even touch the base. They just mug up from 2010 till date.
Right.
You know, that is not the right way. You have to do the base completely and then open e-neutron.
Okay.
In the e-neutron, you need to, for example, choose 2010 paper, and then there will be two tabs. One is training, another one is exam.
Right.
So you need to click on exam and then check yourself that how much you have done in the base.
Right.
So in that way, the confidence builds up, you know.
That's actually great. So what he mentioned is the criteria that we should follow is first of all the base, then we move on to the question papers, and then we go with e-neutron having some tests and all, right? Okay.
Yeah.
And then I'm sure with such hard work, the student is going to thoroughly pass KROK1.
My percentage in the KROK1 was 81.
81% in KROK1.
So yeah.
That is a really wonderful score. So then as you move into your fourth year, how does your mindset change? How does your focus change, and what subjects should the student focus on?
See, what I felt in the 6 years is the first 3 years is phase 1 of medicine.
Okay.
The last 3 years, 4th, 5th, 6th years is phase 2 of medicine.
Right.
Because it is like you are completely gaining all the basics, all the knowledge from the first 3 years.
Right.
Right?
Yeah.
And what all basics you have gained, you have to just apply it in the 4th, 5th, 6th year.
All right.
If you decide that you have to start studying from the 4th year, I'm telling you really that it is highly impossible.
Okay.
It is really highly impossible. It will take a lot of time, I'm telling you. Because, just for an example,
Yeah.
in 4th year you come across a subject like internal medicine.
Right.
Let me take a topic like acute pancreatitis, for example.
Acute pancreatitis.
Acute pancreatitis.
Right.
So in acute pancreatitis, what basically in the clinical part, what all will be there is what is the etiology, what are the causes,
Right.
What
Yep.
are the risk factors,
Right.
what is the pathogenesis, what are the clinical symptoms the patient will be telling you, and what are the signs which you see on the patient, and what is the diagnosis, and what is the treatment.
Right.
These are the things that you see in common with every disease.
All right.
Now, when I take acute pancreatitis, first of all, you have to know where is pancreas,
Definitely.
right? For that, you need to know anatomy,
Yeah.
right? And another thing is, when there is acute pancreatitis, there are some things that are elevated in your blood,
Okay.
like amylase,
Right.
for example, lipase and all. So, if you have to know from where amylase and lipase is elevated, you have to know biochemistry as well,
Definitely.
right?
Yeah.
And secondly, you have to know what amylase and lipase is doing in the pancreas.
Right.
For that also you need to know
Exactly.
biochemistry.
Yeah.
Like lipase is for lipid metabolism and amylase is for carbohydrate, right?
Yeah.
So in this way, and another thing is, there are when pancreas gets necrotized,
Yeah.
you need to know different stages of necrosis in the pancreas.
Yeah.
Stage 1 necrosis needs a specific treatment. Stage 2 needs a specific treatment. Stage 3 needs, so in that way.
Right.
So for that you need to know pathology.
Definitely.
That also you come from these 3 years. So what I'm telling is, any topic you take, any topic from any subject, not only internal medicine, even in pediatric surgery or anywhere you take, the basic thing is all these subjects, they mix up under one topic then.
Right.
So if you really have good basics, I'm telling you, if you really struggle these 3 years, I'm telling you 4th, 5th, 6th year will be really easy.
So that's true. So it's not just that we need to pass KROK1 or KROK2, but for the future, because we are going to be future doctors and then we have to face real patients, right?
Yeah.
So it's very important, not just for KROK1, and that we need to be thorough with the basics first
Yeah.
of all. That are the subjects in the first year. So we're moving on to KROK2 now, yeah? And that's also a big
Yeah.
duration, 3 years. So how did your routine change during your 4th year or 5th year and 6th year, if you could share with us?
So 4th year, really the baddest part
Yeah.
is the 4th year for me. I mean,
Okay.
a lot of personal problems and a lot of robberies, those all happened, and
Okay.
I was completely broke during my 4th year.
Okay.
So during this 4th year, I actually really didn't concentrate on my studies.
Alright.
Because most of the time I was in depression and all.
Okay.
So I couldn't concentrate. But later on, slowly I started to teach practical classes, started to teach the students, and that's how I deviated my mind.
Okay.
So what I did was, in my 5th, 6th year and 4th year, I used to study the main important points.
Right.
When you take a specific topic, okay, when you take a specific topic, you get a hell lot of things to study.
Yeah.
You get around 10 to 20 symptoms in each disease. You need not to know everything. I'm telling you, you need not to know everything. So for that reason, what you need to know is, you need to choose very good and precise book.
Okay.
Like Davidson, Harrison for medicine.
Yeah.
So the best books are Davidson and Harrison. So in that, the symptoms will be so precise and gold standard
Davidson
diagnosis.
and Harrison, right?
Yeah.
Medicine.
Yeah, and diagnosis will be so good. I mean, the gold standard diagnosis will be there, high standard diagnosis, more specific tests, everything from Davidson and Harrison. Why I'm telling this, if you read any other book, you will also read the same things there.
Right.
And you will also have to read some extra points there, which are really not useful. And once if you finish one topic and switch to next topic,
Yeah.
it will be really messed up.
Okay.
Yeah.
So these books are like notes for you.
Yeah, and another last important thing I want to tell is, there is a website called Med Bullets.
Med bullets.
Yeah, the link will be provided in your.
Yeah.
The website called Med Bullets,
Alright.
and in this Med Bullets website, the information is so short.
Med
and
bullets. Yes.
Med Bullets.
Right.
It is so short and so precise.
Okay.
And really, if you learn that short information, and that is enough.
All right.
Yeah, and even you will have questions at the top.
Okay.
You can even solve the questions as well.
Right.
Yeah.
Side by side.
Yeah.
Answer the questions as well. And is there some advice that you can give to the students to motivate themselves to study? I mean, of course, we are studying medicine and we have to study, but still sometimes we lack motivation. Is
Yeah.
there something we can do or you can advise?
See, the motivation in the sense,
Yeah.
see, it is not me giving you motivation.
Right.
At the end, it rests in your hands.
Definitely.
Most of the students, they ask me, they message me that I get deviated very easily,
All right.
right? While studying, I study for 1 hour, 2 hour with a lot of interest, and after that I get deviated. I watch mobile or I watch YouTube and all. See, the basic thing is, deviations, what all the deviations are there, they don't deviate you. Deviations don't deviate you.
Right.
You are choosing them.
Mm-hmm.
You should not choose those deviations. For example, let us say,
So it's a choice.
yeah, for example, let us say you are studying, right?
Yeah.
And there are a group of people who are talking Chinese there.
Okay.
Let us say Chinese language.
Right.
Now, there are two options. One is, you don't understand the language,
Right.
so that you study yourself. Now, when you try to understand what they are speaking, it means you are choosing the distraction.
Right.
If you are not choosing the distraction, you will study yourself.
Definitely.
So what I am telling is, distractions don't distract you. You better stop choosing those distractions. You better stop thinking what they are talking. You better stop looking what they are doing.
Right.
And next important thing is, if you have interest, you will study. For example, if I have interest, I will study. If everyone in this world, if they have interest, they will study.
Right.
And the interest lasts for about maximum 2 to 3 hours. Maximum. After that, the student loses the interest to study.
Mm-hmm.
And what he frames up in his mind is that, okay, I'll study again when I get interest.
Okay.
And we even don't know when the interest is going to come back.
That's true.
So that is not the thing which decides your rank. If you have interest, you will study, but you also have to study when you don't have interest.
Yeah.
It means like you have to push yourself so hard.
So that is where discipline comes in.
Yeah, that is where discipline comes in. See, when you have interest, you will study around 10 to 20 pages.
That's true.
But when you don't have interest, I'm sure the one page also won't move.
Yeah.
Let it not move.
Okay.
But even then, try, even if you take 8 hours to finish a single chapter, nothing will happen. It is really worth.
All right.
But just push yourself. Don't deviate
Don't
anywhere.
give up.
No, don't give up. Just push yourself. It is so hard, so hard. You will have 100 reasons to open the mobile. You will have 100 reasons to go into the kitchen.
Right.
But even then, sit. Just push yourself. You have to forcefully push yourself.
Right. And how many hours did you put in after you completed the first phase of your medicine and you entered in the second phase?
Yeah. After when I entered into the 4th, 5th, 6th year,
Yeah.
I merely spend about 3 hours a day maximum.
Okay. Okay.
Because most of the topics were so familiar with me because I had basics in these 3 years.
That is because you had a good.
I had a good basics in these
yeah?
3 years,
Yeah.
and that helped me in 4th, 5th, and 6th year.
Right.
Or else, really, it would have taken 6 to 7 hours. Because I've seen.
In the first phase, you gave your 7 to 8 hours. So
Yeah.
In the second phase of medicine, that is from 4th year to the 6th year.
Yeah, not 7 to 8 hours, 6 to 7 hours.
6 to 7
yeah.
hours, right. So, in your 4th, 5th, and 6th years, then it reduced to 3 to 4 hours.
Yeah,
right?
3 to 4
Roughly
hours.
3
It
to 4
was really very easy for me to
Yeah.
study the clinical part.
And during these years, did you use some applications like PLAB or something? Or do you want to recommend students are also using this Dr. Najib lectures and stuff like that?
See, Dr. Najib lectures don't touch after 4th year, I'm telling you.
Okay.
If you have to watch Dr. Najib lectures
Right.
to develop the basics, the first 3 years.
Okay, that's
And there is also a misconception that most of the students message me that if I watch Dr. Najib lectures, will I be able to do my KROK?
right.
If I be perfect with USMLE, will I be able to do my KROK? It is really absolutely wrong.
Okay.
KROK is completely different. The way the questions are formed are completely different.
Right.
So when you study Dr. Najib the same topic,
Yeah.
you be perfect with the topic, but when you go to the same question in the KROK, the answer might be wrong.
Right.
Because the KROK questions are so superficial, they don't go much deep. And now the standard of paper is increasing, they might go deep. But what I'm telling is, for KROK, there are a separate set of questions. Prepare that. If you want to prepare for basics, be strong with the medicine and all, then Dr. Najib lectures. And that too, the first 3 years. Don't touch Dr. Najib from the 4th year.
Alright.
Because it is completely clinical. 4th, 5th, 6th year, completely give your time for clinical part.
Right.
Like I purchased an app called PrepLadder.
PrepLab, okay.
Yeah, PrepLadder.
Right.
So PrepLadder is really the good source. I mean, they don't teach you basics, but they teach you what is really important.
Alright.
They'll also have the notes and set of questions. Yeah.
So the application recommended by him is PrepLadder, and not to. Ultimately it's your choice, but according to him, Dr. Najib is going to help you until the first 3 years, and after 4th year we need to move on and focus on our clinical subjects.
Completely clinical. Don't go for the basic. Basics is done now.
Right? Okay. So
But if you have not covered basics, if you have not studied basics in these 3 years,
right.
then I'm telling you, you just need to work hard from 4th, 5th, 6th years. I'm not telling you the life ends in 4th year, that's it, you are done. You can even
So
work.
again, it's never too late.
Yeah, it's never too late, I'm telling you. If you have not studied anything these 3 years, if you are not perfect in these 3 years, if you have just studied 10% in each subject these 3 years, start from 4th year, give time, daily give 3 to 4 hours at least to learn the basics.
Right.
Before you touch any topic, before you touch appendicitis, give some time to learn anatomy of appendix.
Right.
Before you touch peptic ulcer, give some time to study anatomy of stomach,
Right.
physiology of stomach, acid secretions, pathology of stomach and all.
Right.
And then go into the topic.
Okay. So this was for KROK1 and KROK2, right?
Yeah.
So when the student approaches KROK2, like again we have maybe 6 months of gap between KROK2 and the student right now. What changes should the student make in his study routine? And what subjects should he? There were a few students who actually texted me to ask you this question. Are there some subjects that we can focus that are going to help us for KROK2 and NCI as well?
Subjects like
Pediatrics,
internal medicine, gynecology, obstetrics, gynops, right? And these are the 3 most important clinical subjects: internal medicine, surgery, pediatrics, gynops.
Alright.
Don't study social medicine and hygiene here, because the social medicine and hygiene in Ukraine and in India, it is completely different.
Okay.
Yeah.
Hygiene and
Social medicine.
Okay. So again, when there's just 6 months gap between KROK2 and the student, right? So again, previous years,
The same thing, the same rule I have followed.
Right.
That I started with the 2014 base.
Okay.
And I have, there were many questions, internal medicine around 200 questions, surgery around 213 and all. So each question I have taken enough time, each question, each option in detail, You know, in that way I've studied.
With each option in detail.
Yeah, each option in detail. In detail in the sense, now, for example, if you come across an option like acute cholecystitis, don't go for Davidson or Harrison.
Okay.
Because it will take a lot of time.
Right.
Go for this website called MedBullets.
MedBullets.
The short information.
So he's mentioning again the website is MedBullets. Of course, I'll provide the link in the description below.
So in that way, very short information, just immediately finish up all the options.
Right.
So if you are perfect with internal medicine, if you are perfect with each and every option of internal medicine base,
right,
I'm telling you the same concepts, around 45 to 50% of the concepts got repeated in pediatrics.
Okay.
Okay.
Again, relations coming in.
The same things repeated in pediatrics also.
All right.
Yeah. And even in surgery, they also got repeated in surgery.
Yes, sir.
Yeah.
All right. Thank you so much. And so for MCI, now regarding MCI, what are you going to follow and how are you going to prepare?
See, prepare in the sense, now I have around 1 month of time before I go India.
All right.
So I'm planning of finishing at least 5 to 6 subjects here in Ukraine.
Within 1 month?
Yeah, within 1 month.
So that's going to include a lot of hard work, right?
Yeah, of course. If you are addicted to, if you are addicted for sitting long hours and studying, then that doesn't matter at all.
That's going to take you around 8 to 10 hours a day.
Really 8 to 10, but I don't think so I can give 8 to 10 hours, but by myself, according to my capacity, I can just give 6 to 7 hours again.
And that's because he already gave his 6 to 7 hours in the first phase of the medicine. That is in the first 3 years. Yeah, everything is an addiction,
Right. So even students complain me that I can't sit for long hours. What I tell them is daily increase 30 minutes of your schedule,
Right.
Daily increase, sit for more 30 minutes daily.
Right.
So that's how I practice.
Like better than yesterday.
Yeah, better than yesterday. So I'll finish around 5 to 6 subjects here.
5 to 6 subjects in 1 month. All right.
And then I'll go back to India and I'll join some coaching center.
Right.
And then I'll do the rest of the subjects there.
Okay.
Yeah.
And you still have around 6 months for your MCI?
There is an attempt in the in September, not in August.
Right.
In September.
Yeah.
So if I finish by time, I might give in September, or else I'll give it in December.
Okay. So that's your choice. That's up to you, right?
Yeah.
And could you recommend something for, like, there are some students who I guess they're preparing for USMLE and stuff. Is there something you can recommend for them?
Yeah. See, if you are preparing for USMLE,
right,
what I tell is, if you are preparing for step 1, I'll be telling you, and even for step 2 what to do.
Right.
If you are preparing for step 1, you need to have 2 sources. One is USMLE first aid, and another one is Kaplan lectures.
Kaplan notes or lectures, right?
Yeah, Kaplan notes and lectures.
Yeah.
So these both sources are really very important, and they are enough.
Okay.
Yeah, they are enough to have a good score. And even for, if you are preparing for USMLE step 2 also, even there also you need to have these Kaplan lectures at the same time.
First aid,
yeah. I prepared for USMLE, and then again I gave up because I had plans to do my post graduation in another country.
Okay, alright.
Yeah, UK. So
that's PLAB?
Yeah, that's PLAB. That's PLAB.
For PLAB, if you want to recommend.
Yeah, sure. Yeah, sure. But before that, let me tell this, that I finished around 5 subjects. I mean, when I entered into my 4th year, I started off thinking to study for step 2 USMLE.
Okay.
Yeah, step 2 USMLE.
Right.
So during my holidays, I finished around 5 subjects like nephrology, ophthalmology, ENT, allergology, immunology, and all, and so and so. So what I learned is USMLE first aid is the best material.
Okay. Is that going to help with other things?
Really, it will help other things. I'm telling you, really, it will help other things. USMLE first aid, it is really very best thing, and in relation with that, the Kaplan lectures also.
Kaplan lectures as well.
Yeah, but after that, I have plans for other countries, as I told you, so I had to give up. Yeah.
And so you also mentioned regarding PLAB.
Yeah.
If you could recommend something for PLAB or advice.
See, if you wanted to practice in your home country, that is well and good. Right, that is well and good. But if you wanted to practice in any other country like UK, as most of the students even asked me how to prepare for PLAB. So PLAB basically it consists of 2 steps, step 1 and step 2.
Right.
So for step 1, you have a book called 1700 MCQs by Sahith.
1700 MCQs by Khalid.
Khalid.
By Khalid, okay.
Right? And that book, if you are perfect with those 1700 MCQs,
Right.
perfect in the sense, don't think mugging up. Again, I'm telling you,
Like going through-
with the basics, yeah.
Yeah.
So if you're perfect with the basics and all, that book, the 1700 MCQs, then definitely you'll pass step 1. And for that, additional notes are, one notes is called as Unity notes,
Unity notes.
and another one is Samson notes.
Samson and Unity notes.
Yeah, I mean, they both of them are same.
Alright.
These notes, what are these notes are? These notes are the explanations of these 1700 MCQs.
Right.
So they are given by 2 different people,
Yeah.
which are mostly followed basically. So after PLAB 1, then PLAB 2, you have to give it in UK.
Okay.
Right? That is a clinical part which consists of 18 stations, I mean 18 rooms. Each room there will be one actor who will be sitting there.
Oh, okay.
18 rooms.
It's like 18 cases.
Yeah, 18 cases.
Alright.
So in one room you need to go and draw the blood.
Okay.
So you'll have a mark for that.
Right.
And in another room you need to go and I mean the doctor will be explaining that he is having a cancer, so you need to break the bad news to the relatives.
How are you going to deal with the patient?
Yeah, you just can't go and tell he's going to die within 2 days and all.
Right.
So you need to communicate to the patient. So that's what they look.
Oh, okay. So
Right?
That's all practical, right?
Yeah, that is what the practical.
Yeah.
And in third room maybe intubation, and in the fourth room maybe IV, cannula and all.
Okay.
So in that way, yeah. PLAB 2, I think so far for the foreign medical graduates the passing percentage is 98.
For foreign medical graduates, it's 98%.
Yeah, 98.
That's actually a good percentage, right?
Yeah, almost everyone pass in
Almost
that. Yeah.
everyone. But again, it's the hard work that we put in, right?
Yeah.
And so, I guess in this year, for October or September, they're going to have KROK1.
Yeah, October.
October, right?
September, October. Yeah.
If you want to, or if you could give something, a piece of advice for them, what would it be?
Yeah, you basically have really good time now.
Yeah.
Yeah, you really have good time. So what I am telling you is, but if you start from the base like I did, studying each and every option, I think time won't be sufficient for you.
All right.
So what you do is start with the question papers. Start with 2010 question paper,
Right.
but study the way I told you, each and every option.
Each and every option.
Yeah.
And for that also, I think you have some videos regarding that.
Yeah, I have the videos of, the explanations on
I'll
my
mention
channel.
the link to those videos in the description.
So within the schedule should be that within 2 days you have to finish one paper.
Right.
You sit 6 hours, 8, 10 hours, that doesn't matter. You have to, no matter what circumstances you are in, no matter what problems you have, what deviations you have,
Right.
these 2 days, 2 days, one paper.
Okay.
Everything
One
with,
paper for 2 days maximum.
yeah, maximum. And from 2010 to 2000, when you go to 2011, around 60% of the questions as it is are repeated from 2010.
Okay.
So you need not to waste a lot of time there again.
Right.
You just need to look the questions. Yeah, this is repeated. Go to the next. Yeah, this is repeated. Only study the new questions.
Yeah. And how much revision would that require? Like how many times?
Revision.
I mean, yeah, it depends on the person, but someone asked me to mention this, so I'm asking you again.
See, revision, it depends.
Right.
See, some of the students are really they grasp very fastly.
All right.
For example, I take a lot of time to grasp the things.
All right.
I really take an hour to 2 hours to grasp a simple concept.
Okay. Right.
But once I grasp it, I won't forget it.
Okay.
So I took around 3 revisions.
Alright.
I have done around 3 revisions, and I left 1 week completely before the KROK. Yeah.
Right.
So
3 revisions already. You have a week left.
yeah, I intentionally left a week before the KROK. So before that, I have done 3 revisions.
Right.
But I'm telling you, 2 revisions are enough.
Okay.
They're enough.
So it means KROK1 is not that difficult.
Not that
If we are prepared.
Not that difficult if you are prepared the way I told you. Yeah.
Definitely. Thank you so much, Dr. Krishna,
Yeah.
and all the best for your
Thank you.
future. And
Thank you.
congratulations on your graduation as well.